Hi everyone and welcome to my channel Speech with Shell. I'm an adult speech and language therapist and today I'm going to be talking to you about the speech changes that you might see if you have Parkinson's disease. In speech and language therapy, we see a lot of people with Parkinson's disease, either for their swallowing or their speech. Parkinson's disease is a progressive neurological condition that leads to loss of dopamine cells in the brain. Dopamine is responsible for automatic movement, and so you see symptoms such as rigidity, stiffness, tremors, and hypokinesia, which basically means loss of movement or sort of slowness or little movement. Just as Parkinson's disease can affect the muscles of your arms and legs, it can also affect the muscles used for speech, so your tongue, your lips, and even your voice box, because this is a pair of muscles itself in there. So this can cause muscle weakness because the muscles just aren't being used as effectively. So if you have Parkinson's disease, you might notice some changes to your speech. And this includes decreased breath support, so running out of breath before the end of a sentence. You might also experience mumbled or slurred speech, where the rate of your speech is much quicker and it becomes much more difficult to pick out the individual sounds or the word boundaries that you're saying. And this occurs because you just can't reach the target quick enough. So your brain is moving much faster than what your muscles of your lips and your tongue can. You might also experience a change in the quality of your voice. So it might start to sound a bit more hoarse or harsh or have a bit of a roughness to it. You can also experience a reduction in the volume of your speech, and this is a really common one that people find. So you might not notice this yourself, but you might notice that people are asking you to repeat yourself a lot more, or generally just telling you to speak up and that you're quieter. Now, although Parkinson's is a progressive condition, there is hope, because with speech therapy exercises, you can actually strengthen the muscles of your voice and see some improvements in your speech, which is really good news. Once you've made these initial improvements with your speech, the main goal then is to maintain that good level of voice for as long as possible. I like to compare this to going on a diet. So if you've ever tried to lose weight, you've probably eaten less and exercised more. Once you've lost that weight, if you stopped exercising and started eating like your old habits, stopped eating healthily, you'd probably just gain that weight again. Whereas if you continued a sort of reasonable level of healthy eating and a bit of an exercise program, maybe not as intense as you did at the beginning, but that way you would probably maintain your weight. So it's the same really with Parkinson's disease when you're trying to get that improvement. So you might do an intensive therapy program to begin with and see that improvement. But then after that, if you stopped practice altogether, you'd probably lose all of that hard work. So after you've seen that initial improvement, you want to really be still practicing, maybe not as intense as you did at the beginning, but if you still keep that regular practice, you're bound to see that maintenance, and that really is the goal, to maintain. The first thing to do is to get in touch with a speech and language therapist who can assess your voice and sort of give you exercises and a program that is really tailored for you. I've also made some videos on some at-home speech and language therapy exercises that you can do. I would check with your speech therapist first though to make sure that these are suitable and relevant to you. Don't want you to be doing any damage to your voice or working on anything that isn't necessary to work on. So I'll put these links somewhere here for you to click on of those videos. Thank you so much for watching. I hope you gained some valuable information from this video, and I'll see you again next time.